weighted MRI post-radiofrequency ablation for hepatocellular carcinoma.
Bismillah ar-Rahman ar-Rahim. Good evening, dear professors, dear colleagues, and welcome to my presentation. It's Dr. HEBA BALSHY. I feel glad and proud. I feel glad to welcome all the International Society of Radiology here in Egypt. Welcome to Egypt. Bienvenue en Egypte. Benvido a Egipto. أهلا بكم في مصر. And I feel proud, actually super proud, of the Egyptian Society of Radiology, President and Excellence Board. Because of their great effort and hard work, such an event has made here in Egypt. Egypt, the greatest power of human history. Egypt, the motherland of the world. As we say, Masr, الدنيا. Ladies and gentlemen, welcome again into my presentation. I'll talk about value of diffusion weighted MRI in evaluation of treatment response post-radiofrequency ablation for hepatocellular carcinoma. My agenda for presentation, hepatocellular carcinoma as a major global health problem, radiofrequency ablation as a successful treatment, how to assess treatment response post-radiofrequency ablation. Hepatocellular carcinoma is considered a major global health problem. During the past 20 years, liver transplantation and partial hepatectomy have been the main curative treatment lines. However, there are limitations for liver transplantation because of the problem of the international shortage of liver donors. So, radiofrequency ablation is a good solution for the locotherapy that has become an important line for treatment used for hepatocellular carcinoma. Then, an important question comes: how to assess tumor response post-radiofrequency ablation? For many years, magnetic resonance imaging has been an important tool used for evaluation of treatment response post-radiofrequency, but residual contrast enhancement and contrast study may be difficult, especially in renal failure patients. So, we use diffusion weighted image as a complementary tool for characterizing hepatic focal lesions based on calculation of apparent diffusion coefficient, as we say ADC. Our aim to assess the value of diffusion weighted MRI in evaluation of treatment response post-radiofrequency ablation. This study included 30 patients diagnosed with hepatocellular carcinoma. Our patients went and were selected for radiofrequency ablation, and about the post-radiofrequency evaluation of response, we used the triphasic CT as the standard method for evaluation. And for our study, we used conventional MR, diffusion study, and ADC calculation. Conventional MR, we used T1, T2 images, in-phase and out-phase heavy T2. For diffusion study, we measured the ADC by two regions of interest. One, the average of the whole lesion, and the second, the most restricted diffusion area. Concerning our results, CT finding of hepatocellular carcinoma lesions regarding size of managed lesions and also enhancement component diameter revealed 18 adequate managed lesions with percentage of 60 and 12 residual lesions with percentage of 40. This table demonstrates diffusion weighted MRI finding. In the adequate managed lesion, EDC was 1.33, and in residual lesions, ADC was 0.98. This diagram we see on the screen is a comparison between the EDC values in patients with residual lesions and also with adequate managed lesions. As you see, the blue strip is for the complete adequate managed lesions with higher values of EDC. I'll show you two cases. The first one is 43-year-old male patient underwent radiofrequency. We see hepatic focal lesion in segment 8. Triphasic CT shows active residual hepatocellular carcinoma. And the MRI examination show partial response after radiofrequency ablation. About diffusion sequence, this is our main target. Diffusion shows restricted diffusion of the managed lesion, an ADC value of 1.07. The second case, 46-year-old female patient underwent radiofrequency ablation also in segment 6. Triphasic, there is no enhancement, denoting complete response. About MRI, there is complete response as well. For our aim of study diffusion sequence, the diffusion show facilitated diffusion of the managed lesions. Summary, the EDC analysis shows significant change seen about 14 days after radiofrequency. In residual component, in partial responses, there is low EDC value. Finally, we recommended a cutoff value of 1.15. Values below viability of active malignant tissue is high. My grandfather is happy now. Thank you.
Any question for Dr. HEBA? So, 14 days taken as if there is the complete resolutions after radiofrequency. If there is any lesions, no lesion will be seen after 14 days. That we need to comment?
All lesions went for standard protocol of 14 days. Yeah. This is the standard for the standard evaluation we use by multi-detector CT. So we just maintain the same period for MR diffusion, 14 days post-radiofrequency ablation, to have the same changes in cell and tissues, to have proper comparison between multi-detector CT and MR diffusion image.
Okay, thank you.
Thank you very much, Professor. Thank you.
And thank you for your presentation and introduction.
دكتورة هبة بعد إذنك